Hi, today's video is about the diagnosis and treatment of a thumb sucking habit in the mixed dentition. Thumb sucking is something that children commonly do in bed at night, sometimes while they're watching TV or doing their homework, and it has a significant effect on the way the teeth and the bite continue to grow and develop. Children suck their thumb for lots of reasons, often emotional, but the habit should be discouraged and discontinued as soon as possible to allow for the correct growth and development of both the teeth and bite. It tends to happen mostly when children are in bed at night, and the diagnosis is often helped by the fact that when we examine the teeth, we notice that children develop what we describe as an open bite or anterior open bite. This is where the front teeth have a large gap. They don't overlap, and it's because when the thumb is in the patient's mouth, the teeth are unable to grow or erupt into position. So in the photograph of this case, a patient called Rose, who presented in the mixed dentition at 8 years of age, you can see that she has a large gap between her front teeth. As well as that, she started to develop cross bites on her side teeth towards the back as a consequence of the pressure from her cheeks when the thumb is in her mouth or in position. The treatment of the tongue sucking habit starts with a discussion around the effect that it has or is having, and the patients are encouraged to give up the habit. We generally have this conversation with the patient after maybe a month or 6 weeks, and if the parents report that the habit is continuing, then we take active steps to help resolve the issue. This is easily achieved, so usually a combination of a thumb guard that the patients wear, usually in bed at night and during the day, normally full time for about 6 weeks, is enough to break the habit of the thumb going into the patient's mouth. The second habit that develops, where the tongue gets between the front teeth, is then broken with the aid of the habit breakers glued on the inside of the upper front teeth. So now you can see that the use of the thumb guard and the habit breakers allowed the front teeth to start to erupt and develop. Also, the back teeth started to widen out spontaneously or naturally themselves, and we then just continued to see Rose roughly every 6 months until all of her teeth had grown and developed at about 12 and a half, 13 years of age. In Rose's case, the teeth grew into almost perfect alignment. She did have narrow upper front teeth that we eventually enlarged with some composite bonding just to improve the overall aesthetics of her teeth and smile when she was a little older in her late teenage years. And we saw her up to the age of 16, 17, and you can see even at that stage her teeth and the bite had grown into an almost perfect position, but just breaking the habit or the tongue sucking habit that she had developed as a child.